Spring has arrived, and with the beautiful weather we've been enjoying here in Central Florida, CentraCare doctors have seen an increased number of sports-related injuries coming into the office. But it's not just fractures, sprains, and strains they're taking care of. They're seeing a fair number of head injuries coming in. Now, a head injury can be as simple as the bump I personally experienced at the top of my head when something fell off a shelf in the garage and conked me on the head. Now, it hurt for a few minutes, but with some ice and Advil, I was fine in a few hours. But how do you know if it's a more serious head injury like a concussion? Well, a concussion can happen after a person is hit in the head, face, or neck, a blow to the head resulting in confusion, memory loss, and headache. Now, although the brain is surrounded by this thick, hard protective bone called the cranium, it is floating in cerebral spinal fluid, and that adds a little extra cushion, but as a blow to the head causes the brain to kind of slosh back and forth inside the cranium, can lead to bruising of the brain tissue and perhaps even bleeding, which is a medical emergency that could possibly result in death. So how do you know when you have a serious head injury? You should seek immediate medical attention if you have a loss of consciousness, a seizure, if you have a severe or worsening headache, vomiting, confusion, difficulty walking, or difficulty seeing. Now, if you were the friend or family member watching this person that's had a head injury, have any of those symptoms, immediately go to the emergency room, call 911. And if they fall asleep, it's okay to allow them to fall asleep, but watch them. Wake them up every hour to 2 hours to make sure that they can wake up. If they can't wake up, get them to the emergency room.